Symptoms of asthma attack. These include dyspnea and wheezing, cough, chest tightness. Note that between the asthma attacks, patients with mild asthma are typically asymptomatic, with no symptoms. Let's talk about dyspnea in the asthma attack patient. Dyspnea in the asthma attack patient starts abrupt, usually during the nighttime. 4 a.m. is vagal predominance, temporal relationship to the exposure to the trigger. An expiratory dyspnea, this dyspnea in the asthma attack patient is an expiratory dyspnea. The wheezing predominantly during expiration. What about the cough in the asthma attack patient? How can we describe the cough? It is dry at the beginning, becomes productive. The sputum has a pearl appearance, mucus clear and adherent. What about the microscopic examination of this sputum? Kirschmann spirals, Charcot-Leyden crystals, and in cough variant asthma, no dyspnea. What can be noticed in the general physical examination of an asthma patient? Antidyspneic decubitus, anxiety, tachycardia, mild hypertension, and no cyanosis. Let's talk about the respiratory examination for an asthma attack patient. First, you inspect for any hyperinflation, barrel chest, palpate, diminished elasticity, diminished tactile firmitas. As for the percussion, it's diffuse hyperresonance. When you percuss, you will feel diffuse hyperresonance. What about the auscultation when you hear? Important prolongation of expiration, usually more than 1 to 3. Diminished vesicular sounds, rales, which are bronchial rales, wheezes predominates, plus rhonchi and coarse crackles. Wheezes are persistent after the end of the asthma attack. Let's talk about the paraclinical examination. Chest X-ray is not mandatory, shows hyperinflation. The lab, there is a mild leukocytosis with eosinophilia and elevated IgE, which is for allergy. Sputum microscopic examination and pulmonary function tests. What is the differential diagnosis with asthma attack? The differential diagnosis of asthma attack is cardiac asthma, which is clinically dominated by the bronchoconstriction. What is status asthmaticus? Status asthmaticus is an asthma attack lasting more than 24 hours despite the adequate therapy. Not only temporal definition, but implies severity. Respiratory failure can intervene, cyanosis, hypoxemia, determined non-invasively. Hypercapnia and hypoxemia confirmed by ASRAP. Flapping tremor as an expression of hypoxic hypercapnic encephalopathy. Clinical examination of status asthmaticus. Diminishing of the vesicular sounds and rales. Sign of severity, together with thoraco-abdominal balance, can predict respiratory arrest. Thank you for watching and looking forward to see you in the next video with a new topic.